Isabel?
Cheryl Gardner, who has the condition, and both are joining us in the studio now. Cheryl, should we start with you? Because we talked about this affecting large numbers of young people. You are just 39 and living with multiple sclerosis. Yeah. Just tell us a little bit about your own story, how you first began to think that something was up.
I was only the age of 26 when I actually was diagnosed with MS. I started to notice the balance, coordination, and my vision went in one eye and then it went in both. And then it came back, and it was a process of actually going to the doctors 5 times because I knew that there was actually something not quite right. So if you can't lift your head off the pillow to actually just get to the bathroom and then you're using walls to get to that place, then there's something not quite right.
And that was at the age of 26?
Yes.
So how have things developed, changed in that period? Because what's a sort of good decade later?
Well, I've been managing it quite naturally, so I've had relapses in between, quite far apart since when I was diagnosed. And really, I know there's been loads of changes with myself, so I changed my lifestyle, changed the way I guess my job as well, I've had to change that. And also my support network, because I needed positive energy around me to be able to get through difficult times, especially when MS is so unpredictable.
Mm-hmm.
Well, we're hearing Cheryl's story there, Dr. Sarah, and multiple sclerosis, as I understand it, it affects your brain, it affects your spinal cord. The coating that protects your nerves is damaged with that, and it causes a range of symptoms, as Cheryl was explaining there. How do you get it, and is it with you for life once you do get it?
So, as you've said, 130,000 people in the UK live with multiple sclerosis or MS. And as you said as well, MS attacks the nerves in your body, and that can make it very difficult to do everyday things such as talk, walk, eat and think. There are a range of different symptoms associated with MS, for example. It may include fatigue, pain, tingling sensation or eye problems.
It must be awful, because basically what you're talking about is it affects everything, everyday function. You want to make a cup of tea, you want to wash your hair, you want to brush your teeth, whatever. Almost everything that you do could be affected, and you're thinking, why?
And also, MS is different for everybody as well. It's a very unpredictable condition. What one person experiences will be very different for another person. Symptoms can come and go, be mild or more severe. That makes it quite difficult to diagnose.
So you've got remission. You can have remission.
You can have relapse in MS, but also progressive MS. And there are various treatments available for people, but it can make life very uncertain. We can't actually at the moment stop MS, but there are treatments becoming available.